Good morning. My name is Kulaimirgan Abu Talib, and let me briefly explain our work titled Improving Stain Invariance of CNNs for Segmentation by Fusing Channel Attention and Domain-Adversarial Training. One of the problems that prevent adaptation of AI solutions in digital pathology is a variability in staining protocols used in different medical centers. A distribution shift can negatively affect deep learning models' performance during inference stage. In addition, though the same chemicals can be used, there are other factors related to acquisition and storage of raw tissue slices that affect the final appearance of a whole slide image. For this, we propose a novel method for improving generalization capacity of CNNs for whole slide image segmentation when data is available from only one source. We also aim to extensively analyze the method and its combination with other suitable approaches, for example, stain augmentation. To be more specific, in this work we focus on tissue level segmentation because it's an important part of whole slide image analysis pipeline for various downstream tasks. Another important detail is that though the number of studies adapting vision transformers is rapidly growing, we focus on CNNs because recent credible studies show that their potential is still underexplored. Let me explain the main idea of the proposed method. Recent studies indicate that style features exist as feature covariances in earlier network layers. We aim to suppress covariances that are sensitive to stain changes. To do that, we combine channel attention and stain invariant training scheme. To find sensitive covariances, we first apply stain augmentation to the given image and compute covariance matrices of feature representations of both original and modified image. Next, we compute a variance matrix that represents difference between two covariance matrices. Then we use a fully connected layer to obtain channel weights. Now after reweighing feature maps, we use stain adversarial training branch as a suppression mechanism. The method is based on domain adversarial training. And in our case, staining information is used instead of domain labels. To expound, we use optimal stain vectors as domain information. Finding optimal stain vectors is an intermediate step of one of the pioneering methods for reducing discrepancies between whole slide images, Masenko stain normalization. For evaluation, we use 4 public datasets that come from large medical and research institutions and were annotated by expert pathologists. As for our experimental setup, we use the following hyperparameters. We use 2 encoders, ResNet and ConNext. Our main evaluation metric is DICE score, and we also report precision and recall. We also use stain normalization for additional validation. Similar to previous studies, we compare our results with methods specifically designed for improving stain invariance of a model. Overall, with both encoders, we obtain considerable improvements over the baselines and competitive scores compared to other approaches. And combining the proposed method with stain augmentation gives the best results on average. Some qualitative examples. As it can be seen on this image, baseline model does not capture anything. In this case, it's a glomeruli in kidney, and the proposed method helps to alleviate the problem. And some similar cases. To sum up our contributions, we propose a novel method for improving the generalization of CNNs for segmentation specifically. This method can be integrated with existing models, including pre-trained versions. We show that combining our approach with stain augmentation leads to mutually beneficial results, and we provide an interpretability analysis of how the proposed method affects model parameters. All of the other details and analysis can be found in the paper. Thank you for your attention.